Think about that for a second. Let that sink in when all these other issues we're talking about is out there.
How do I do that?
We're the largest healthcare system in the country. I can't tell you.
Veterans all over the country have been dying, waiting to get treatment.
Now, here's the interesting issue.
480,000 VA employees. There are 480,000 VA employees, and there are 450,000 active duty Army.
Yeah, that's about right.
Now, and veterans all over the country have been dying, waiting to get treatment. Commit suicide, dying, because they can't get. So with 480,000 VA, that's 30,000 more than the active Army members. How can't they? Why can't they get in, or why couldn't they get in?
Well, because a lot of it. Think about that organizational structure. Where is most of that organizational structure going? I've been told since we started the confirmation process and we started asking these questions. Well, PACT Act did this. PACT Act forced us. And by the way, that was Biden thought of it at State of the Union. A few months acted it, not really thinking about cost. And by the way, when the House and Senate, I speak Hill because I was up there for a long time. Here's what you do. You want to make somebody think you're doing something. You pass a bill. You leave a lot of the stuff in the middle, either unfunded or open-ended. You get the president to sign it, and then you declare it a victory. Never mind going to the actual agency that's going to have to do this and give them and help and instructions on how to make it happen. But I was told that was why the monies and everything increased so much. Well, I've asked, where are these employees that were hired for PACT Act? I mean, if we've hired all these employees to do PACT, where are they at? And only get one-off answers like, well, we've had to do something here. We can't. All right, I come here to share the truth. I'm just not BS anymore. I mean, I just can't. I don't know whatever. But I can't tell you where all 480,000 of those people are. I can't tell you. Now, here's the interesting issue. You were in the military. You were in the SEAL team. If you went to your commander or you went to your headquarters, headship, they could actually look down a list. They could pull every base. They could pull every unit. They could pull everything. And by the line item, tell you who was assigned where and what their billet number was, what their pass number was, and everything else. You would know exactly where they're at. I do not have an HR system that allows me easily to do that. Think about that for a second. Let that sink in when all these other issues we're talking about is out there. So I can't even, at this point, now I'm working on it. That's been one thing where I've already hit the ground running. I've got some people that are helping. We're going to try and fix that pretty quick. Because if I don't know where they are, then this organization is functionally not ready for action. It's just not. Mm-hmm. And you got a lot of things. We've had organizational structure at the, cutting bureaucracy in the management level in Washington and across the plains is going to be something that was one of the first looks we're going to be. I don't need 6 people. I mean, it'd be like, I'm trying to put this in maybe ways that your guys and folk and gals would understand who watch this podcast and listen. It would be almost like having in one unit, having 6 from Air Force, having 6 shirts in one unit. Which one do you go to? Who answers to who? And then also having 2 or 3 chiefs above the 6 shirts to say, well, go get that approved, go get that approved, go get that approved, go get that. Oh, and then, by the way, we'll have to go find the wing commander to sign off. So from an Air Force perspective, it's just bureaucracy layers. Some of these were started for real reasons. That, hey, we need to manage our like central vision care, which is our bishop division. But they were supposed to have 20 and 30 people. Now some of them have 3 and 4 and 500. They just grow for the sake of growing, but nobody has called it like I'm trying to call it now in a real sense of a way, is to say, what is our return on investment? Are we helping a veteran? Is the veteran being helped? Not a press release from the Hill, not a bill that says you think you're doing something, but are we actually doing stuff that allows the veteran choice? By the way, the Mission Act, what we talked about, is to let you go out in the community. We're going to pay for that because you've earned the benefit. We're going to make it where you can go out into the community and get the care you need. But yet over the previous administration, we have documented it, and we're going to be rolling out more of this, where we saw basically a turn toward de-incentivizing and actually keeping veterans from getting the care they need, even if it meant waiting longer. Sean, the more I dig, the worse it gets. And we're right now making sure that we're starting to get out so that we can have a whole new culture shift to help the people we're supposed to be helping.
How is that going to work? How do I do that? How do I use the VA to pay for my community health care in the civilian market?
If you meet certain criteria like distance and time, especially what it was designed for is especially those who are away from a VA health clinic or a center that where they can get it quickly. What they can do is a real simple checklist to see, do you qualify that? And most you do in different areas, especially specialty care. And then here's where I don't like some of this, and I've not liked it for years. One, we have a third-party administrator, which we're actually looking at. Anytime you put another third-party anything in there, it tends to bog the system. They're supposed to be finding community doctors. They're supposed to be finding the system where we send them to. The VA technically still has a sign-off right now where you see a VA dot and the doctor says, yeah, we agree, and then you send them. That's becoming a little bit of a problem because we've seen some issues in which the referrals were not happening. Okay, so again, I'm digging into this. It's not everybody, but I'm seeing it enough to develop a pattern here. You see it, randomly, you might think no, but when you start seeing it enough, there's a pattern of what I call abuse of the law, basically. So you get that, and then you go, and then it's turned in, it's paid for just as if you were going to, through the VA system itself. So these are out there. These parts have been there. Well, Mission Act gave that, it expanded that, but you got to also use it. I mean, I can give you the best rifle in the world, but if you don't use it, it's just useless to you.
Well, I think a lot of people don't know how to use the VA system. I'm one of them.
Yeah.
I mean, and I want to get into this later, but I mean, even just to get the initial, to get the benefits, to go through the doctor's appointments, to, oh, my shoulder's messed up, I got tinnitus, I got TBI, whatever. All those, what do they call those? The initial appointments?
The consults, yeah.
Yeah, the
initial
consults,
yeah.
A lot of vets, they don't even know how to get into the consults. Or then you get in the consults and it's almost like a damn interrogation. And it's like, I'll give you an example. They denied my tinnitus. Dude, I'm a Navy SEAL. I shot a lot of guns. I blew a lot of shit up. I've seen a lot of combat. I have fucking tinnitus.
Yeah.
Sorry, lady. I don't know, what the hell you're talking about. You can't even test for that. Just give me the tinnitus. Look at my service record. They deny it. And then I got to go find, then I got introduced to this woman, Peggy Matthews, Veterans Advocacy Services. She's probably 80 years old, runs it, is like an angel to me and my guys, because she's the one that can take our package, turn it into something, and somehow, some way, she gets it fast-tracked through the VA. But for us to try to navigate the Veterans Administration, it's impossible.
Why should we have that, Sean? Think about that.
Well, that's what I'm asking.
Yeah, well, but I'm also bringing it back is someone, look, looking ahead, in 5 weeks of sitting here doing this job, I have been seeing asking the exact same questions, and say, why is it you have to have a VA whisperer, so to speak, to get what should be honestly yours to state and to take part in? Okay, you're exactly right. I mean, right now, as we look at this is the concern that a lot of us are having. But how many government agencies are like this? Think about it. You're supposed to pay your taxes. I'll just use another. The IRS, you're supposed to pay your taxes. But yet you call the IRS hotline and they can't answer your questions. The very ones who will put you in jail for not paying your taxes can't answer some of your basic questions about how to file your taxes. Well, as we get into the process of the VA, and I was just with a local vet center here, and one of the things I asked him, I said, tell me something. Start telling me, getting up to me, tell me things that hinder veterans from getting the benefits or being a part of this system. Tell me what in our paperwork process, what in our setup is causing us problems. Because here's what we are seeing, though. To those, unlike some experiences you've had, especially a number of years ago, but what we're seeing today, there's been an improvement, is that once they can get through the system, we're seeing general satisfaction rating among veterans of different generations saying, okay, this may not be, they like the care. They may not be what I want. It may not be for everybody, but 80, 90%, saying, hey, this is okay. I'm getting what I need. Or the benefits, they're getting their package. But getting to it has been our problem. Getting it through that front line to say this is an agency that is open. Look, I don't have my phone with me right now, but if I had my phone with me right now, I bet your private insurance. I know my health care with my wife, who I've been on state health in Georgia forever. I can right now pull up on my phone all my prescriptions, my doctor's appointments. I could talk to my doctor if I wanted to. We don't have that. Why is the large? And here's the other thing: we're the largest healthcare system in the country, by far, by far. Now, there's a couple of privates that like to say they're closed. I have 170 hospitals, over almost 1,500 CBOX clinics, and that's not counting the mobile stuff we do and everything else. That's how massive this organization is, okay? And they've all run on siloed issues. I heard an issue today that was about, just simple things as transportation. Well, and when they were asked for help, they said, well, that's not a VHA issue, which is our health side. That's a VBA issue, which is our benefit side. Well, I'm here to say I'm the secretary of all of you. We're going to start acting like we're one company and not three companies working in the middle. And we got to, but again, Congress has facilitated this. Some prior administrations have facilitated this. Because here's the thing, Sean. How many times have you run across somebody who wasn't a veteran? And especially in public life, if they're not a veteran and they run for office, it's hard for them to have honest questions to a veteran or to veteran service organizations, which may or may not have the interest that they need to be promoting, or another organization. And they say, well, and I had a gentleman on the floor of the House one time, and good friend, good guy, never served. And there was an issue on the floor. And it was wrong. It was just wrong. I mean, we should be doing it differently, okay? There's a budget item. And I said, and I went to this person, and I said, because they're very vocal, I said, this is wrong. We shouldn't be doing it this way. This should go into the budget. It shouldn't be done separately. This is the way we should be done. And I'll never forget, and it just floored me. The person looked at me and he said, Doug, I know that. He said, but I'm not a veteran. And he said, I can't have somebody attacking me as being against veterans. Sean, think about what he just said.
No matter where you're watching Sean Ryan Show from, if you get anything out of this, please like, comment, subscribe, and most importantly, share this everywhere you possibly can. And if you're feeling extra generous, please leave us a review on Apple and Spotify podcasts.